Thank you, Mr. President. Thank you for the recognition. I wanted to come to the floor today to talk about, briefly, the Supreme Court decision on health care. One of the things I want to say is I was in Colorado last week. We had a wonderful time traveling across the whole western slope of our state, spent time in Gunnison County and other places. We fished in Hartselle. And one thing people were not talking about there was the Supreme Court decision on health care. What they were talking about was how we get our economy moving again, how we recouple our economic growth in this country to job growth and wage growth again, how we create a comprehensive and thoughtful approach to reducing our deficit and our debt, how we educate our kids for the 21st century, how we build this economy in this country to make sure that we leave our kids with something better than what we found. In short, they were talking about exactly what people in the Beltway are not talking about. Today, the House of Representatives, Mr. President, I don't know whether voting has started yet or not, but is voting to repeal the health, in the wake of the Supreme Court decision, is voting to repeal the health care reform bill for the 31st time. They have been successful 30 times. They have voted to repeal the bill 30 times, but they feel the need now to do it a 31st time. And, Mr. President, I saw on the TV in my office today the Twitter that was going, the traffic that was rolling at the bottom of the screen as one person after another announced gleefully that they were voting to repeal the health care bill for the 31st time. And I thought about a Facebook post I saw last week from somebody I know in Denver named Mary Sewell. She's on the school board there, but she's not a politician. And this is what she wrote the day after the Supreme Court reached its decision on health care. Mary wrote, "Yesterday's Supreme Court decision upholding the Affordable Care Act came on a hard day for our family. Yesterday afternoon, we learned that our 6-year-old Annie has type 1 diabetes. She and I sat in a doctor's office crying through her first finger prick, her first insulin shot. Our life is now different. She will have this disease for her entire life or until there is a cure. A few years ago, our entire family might have lost our insurance. She now has a pre-existing condition that likely would have made her uninsurable as an adult. What I am saying," Mary wrote, "is not political. It's a mother's sigh of relief. A mother's sigh of relief. When I heard the Supreme Court ruling, I was waiting for the call. I was waiting for the call to tell me why my baby looked too thin, while she had to take breaks walking up a flight of stairs, why she had started wetting her bed. The ruling means she lives in a country that won't leave her behind. We are very lucky that we caught this early, before she lost consciousness or went into a coma, something that would have likely happened in the next few days. I know our luck came from health insurance that allowed her worried parents to take her to the doctor because we had a, quote, bad feeling. Many families, even insured ones, can't do what we did. I was raised on the idea of better to be safe than sorry. Our healthcare system has been better sorry than safe for too long." Mr. President, Mary goes on to say that the Supreme Court decision couldn't have come at a better time, our family's worst day. I hope that the folks that are twittering out their repeal for the 31st time of this bill, rather than working to try to improve it, rather than working to try to fix it, incapable of actually telling us what they would replace this with, would take a moment to read what a mother in Denver posted on Facebook last week. I don't think this health care bill was perfect, and I've said that from the day that we passed it. There are issues around cost in particular that I continue to be very concerned with, because despite the rhetoric around this place, the reality is that we can't solve our deficit and debt problem in this country without dealing with a restructuring of how we deliver health care in the United States. And maybe this bill isn't perfect, and maybe there are suggestions that could be made to improve it. I have my own. I tried, when we passed the bill, to put a fail-safe in place that would actually hold this Congress to the numbers that it said it would save, the dollars that we said that we would save, and if we didn't, that we had to figure out how to cut or to make other changes to get there. So there's more work to be done. But the thing that I find amazing, and this is why I wanted to come to the floor, Mr. President, is how far away this conversation is from the people that I represent. And what a masquerade so much of this conversation is. I know there were a lot of people that were disappointed that the health care bill was declared constitutional by the Supreme Court, and there were people that said they were going to declare it unconstitutional, and they didn't. And so the next day, and really for the next week, what we heard was, well, the bill imposes a tax on the middle class in this country, that the president broke a promise because he said he wouldn't raise taxes on the middle class. I want everybody to know what's being talked about when people talk about this. They're talking about a piece of the legislation called the health care mandate. Some people call it a penalty, and some people call it a tax. That's something that's been debated around here for the last week. It hasn't been debated before this, and I don't care what label you put on it, frankly, because people at home are not talking to me about this. And you know why they're not talking to me about this? Because it applies to 1%, 1.2% to be precise, of the American people. That's what the Congressional Budget Office told us when we were passing this legislation. And if you don't believe me, it is on page 37. Mr. President, I won't enter the whole opinion into the record. Maybe it's page 33 of the Supreme Court's finding of fact, where Justice Roberts finds as a matter of fact that the CBO said this mandate would cost $4 billion and that roughly 4 million people would be affected. Those are the 4 million people after Medicare and Medicaid and private employers' insurance and personal insurance that people buy. That is a group of people, a sliver, 1% of the American people that can afford to buy insurance but don't, and choose to pay the penalty or the tax or the mandate instead of buying their insurance. $4 billion, 4 million people. What the health care bill was intended to do, and again, may not have done perfectly, and there may be other ideas that we ought to be legislating around, what it was intended to do was solve a problem that confronted not 1% of the American people, not 4 million people, but a problem that conservatively, extremely conservatively, affects 50% of the American people. And is a $58.5 billion problem, not a $4 billion problem. Because it's 50% of the people that are covered today by their employer who have to pay $1,100 a year in premium, in additional premiums, to subsidize the uninsured in the United States of America. That was one of the big objectives of dealing with this health care issue. And I say it's conservative because this number doesn't even include the people that are buying insurance on their own. And so maybe if you add those numbers together, you get to about 70% of the American people. So we spent a week on the cable television, on the floor of the Senate, occupied completely with this 1% number over here, with no theory at all about what we're doing for 50% of Americans. That's how comical this conversation has become. I shouldn't say comical. That's how detached this conversation has become from what's actually going on in the real lives of the people that I represent and others in this chamber represent. And what's so amazing to me, having watched this as somebody who has not been around here for very long and may not understand all the ways of Washington, is that when you look at the history of this so-called mandate or so-called tax, it's really puzzling to understand the politics around it. This is a chart that is part of an article that ran in the New Yorker a couple weeks ago called The Unpopular Mandate by Ezra Klein, and I'd ask, Mr. President, that the entire article be made part of the record.
Without objection.
And I'd urge people to read this, because what Mr. Klein does in this article is chart the political course of this mandate from about 1989 to the present. And the red are the years in which this was a Republican idea, advanced by Republican members of Congress and by think tanks like the Heritage Foundation, who actually came up with the idea to begin with, to deal with the fact that there were people in this country that weren't buying health insurance and that we were all subsidizing. And then when it became a Democratic idea in more recent times. It strikes me as one person watching all of this that this might have more to do with the party that's in the White House or not in the White House than it does with respect to the merits of the idea. But it's, of course, the merits of these ideas that we should be debating and talking about. But we shouldn't be telling the American people that something that affects 1% of the American people is a broad-based assault on the middle class. And we should be bringing to this floor the ideas we have for improving what 50% of the American people or 70% of the American people are already facing. That is what people in our state believe. Here's part of an editorial from the Greeley Tribune, which I think was published yesterday, where they wrote, in 2010, the North Colorado Medical Center provided more than $71 million in services to indigent patients who didn't have health insurance. It wrote off another $29 million in bad debt. Eventually, the Greeley Tribune writes, insured patients must pay for that in higher premiums and co-pays. Mr. President, I'd ask that that editorial be made a part of the record.
Without objection.
Thank you, Mr. President. So what I want to say is I believe that folks in Colorado have moved on here, that they want us to improve this legislation, that they want us to get focused on the real matters at hand, which is getting this economy going again, getting us into an environment where we have rising jobs and rising wages again, and they're a lot less interested in these talking points. I don't understand why people that are in politics can simultaneously make such a big deal about this. It affects 1% of the people in this country. And at the same time support legislation, for example, that forces women, that mandates women to have procedures before they can make a choice about their own reproductive health. It doesn't make any sense because it's completely inconsistent. And I have a daughter, Annie, who's 7, not 6 like Mary's, but it's her health care and the certainty in her life and in her sister's life and the thousands of children across my state whose health care we should be interested in. So I can see that other colleagues of mine have come to the floor, so I'm going to move along here, but I want to just, before I do that, and before I yield to the Senator from Maryland, say that if this repeal happened in the House, and then this repeal happened in the Senate, and it were signed into law, 932,000 Coloradans who have pre-existing conditions would lose their insurance. 50,000 young adults in Colorado who can now stay on their parents' insurance until they're 26 would no longer be able to. Women could once again be discriminated against simply because they're women. It's welcome to 696,000 women in Colorado that need maternity care or other women's health services, that they're not going to be charged higher premiums since this law is in effect. And when these exchanges are set up, 521,000 Colorado children will, for the first time, have better vision and dental coverage. I want to work in a bipartisan way going forward to to try to make sure we're doing everything we can to follow the examples of places like St. Mary's Hospital in Grand Junction, or the University of Colorado Hospital in Denver, or Denver Health in Denver, to drive higher quality and to drive lower costs. It's essential. It's essential for our economy. It's essential for our competitive position in the world. And it's essential that we put these talking points down and start actually dealing with the facts as they are. And with that, Mr. President, I thank you for your patience, and I yield the floor.